I'm fortunate enough to be the Chief Executive of one public health agency in Scotland. I meet with colleagues from not only across Scotland but across the UK. It's such an important event in the calendar just to have that opportunity to be learning about new things that are happening and to really share the challenge about public health leadership.
This is a really important opportunity for us to come together. Lots of people from lots of different backgrounds, lots of people in wider public health, not just those working in public health departments, to actually come together and take some time out of the office and the general work and really think about what we've done, hear about the work people have done, but then also think about the future and where we want to go.
The people in this room are the workforce who will make the differences. And how do they make the differences? Well, they take the evidence of what works to narrow them. They influence people as much as possible to take the right decisions, which create opportunities for people at local level.
This conference is taking us right out into society, into health behaviours and into how communities work, and that is a wonderful exposition for us all.
I think this conference is mainly about sharing what we know. The reality is we have common problems across the whole of the country and we can share solutions. Different things have been tried in different areas and it's important that we learn from each other. So for me it's primarily about networking and sharing information.
To have an independent conference within Scotland enables us to have a focus on the things which are different and special about public health in Scotland. But it's also a great opportunity to bring colleagues in from England and Wales and Northern Ireland, and indeed today internationally we've had colleagues from New Zealand. I think it's also important because Scotland does lead the way on a number of different fronts, and it's a great opportunity to showcase a lot of that work.
Oh, I think there's always going to be something that I can learn coming to see how things are going in Scotland. Scotland does tend to have a really quite a good track record of taking quite a sort of firm public health approach, which we do have in New Zealand as well. But you can always learn something seeing how other people do it, and I'm pretty sure I've got a few things that I want to try and pass on to my colleagues here, that things that we're doing quite well in New Zealand as well.
I think having people think differently, I think being challenged, and also for the people in this room who've been listening to all of the speakers, they have so much more information for going back to where they work. But as well as that, I hope that they are going to go away believing that they are the ones with power and influence to try to change public health across Scotland, because they're the experts.
I'm delighted to be here at the conference. I think the breadth of plenary and discussion sessions show just how broad the variety and remit is of public health and how it impacts on every age and stage of our community's life. I think it's important that we work together. We're a country of 5 million. I think if we work together and pool our collective resources together, that we can overcome some of the persistent challenges that our country faces around obesity, around our relationship with alcohol, and of course with smoking and inactivity levels. I think there's a real opportunity, there's a collective desire to deliver results, and I'm really pleased that as the Minister for Public Health I'm getting the opportunity to work with so many dedicated and talented people across Scotland, delivering real change and transformation in the communities, and I look forward to working with that community of people very soon over the months and years ahead.